there's a lot of medical news to tell you about tonight, and our Monica Robbins joins us to fill us in.
So, Monica, you're here with 3 things to know. First, let's talk about the COVID vaccine. So many of you want to know when you can get a new one, but there might be an alternative option that does not include a needle, right?
Yeah, just not here yet.
Just not here.
Unfortunately, yeah, because you know, while many are waiting to get their new bivalent vaccine, India and China are moving ahead with needle-free options, one by nose, the other by mouth. Regulators in India authorized a nasal version COVID vaccine today as an option for those who have not yet been vaccinated. It's not clear how well it works or when it will be available. And Sunday, Chinese regulators approved an inhaled version to be used as a booster dose. The manufacturer says the inhaled version revved up the immune system just after one puff. So think of that one sort of like one of the asthma inhalers that you would use. Now, there are a dozen at least of different nasal COVID vaccines in research trials right now. A few of them have actually made phase 3, but it's going to be months, if not a year or so, before we see them.
Well, then, I was going to say the natural question, when will we get them here in the United States? We're talking about here?
Yeah, we're talking about quite some time. You're more likely going to get access to your bivalent COVID vaccine very soon, if not tomorrow. You know, those are available right now. Summit County Public Health actually is having a drive-through vaccine clinic tomorrow and Thursday with new vaccines, but appointments are required. And then there you see them. The COVID response, White House COVID response team held a press conference today saying for the first time, they have vaccines that are finally caught up with the circulating variants, and there's hope that the days of booster shots may be coming to an end.
For a large majority of Americans, we are moving to a point where a single annual COVID shot should provide a high degree of protection against serious illness all year.
They added that by the end of this week, more than 90% of Americans will live within 5 miles of a place offering up the new updated vaccine. So if you want one now, time to make your appointment. That's what everybody has to know. So you can get those. We're going to have to wait a little while for the other kind.
Okay, so we hit COVID. Now let's go to bird flu. Is it in Ohio? Should we be concerned? Talk to us about it.
It's not the first time we've seen bird flu in Ohio, but yes, you got to worry about it if you own a flock of chickens, and a lot of people do, yes, even in the suburbs. Bird flu was detected in a backyard flock in Ashland County and a commercial chicken flock in Defiance County. Now, it spreads fast. It can be fatal to chicken, turkey, pheasants, quail, ducks, and geese, and it's often spread by those wild birds. So if you have a chicken coop, the Ohio Department of Agriculture is advising to keep your birds indoors or protected from those outside animals. This one is called highly pathogenic avian influenza, or HPAI. No human cases have been detected in the U.S., and it can't be transmitted through properly cooked meat or eggs, and no infected commercial products can be sold. But this is something everybody needs to be aware of. This is not a public health emergency as of yet, but in the past we have seen avian flu be spread to feral cats and that sort of thing, and people who have long-term exposure could potentially be at risk, but so far we've not seen that with this one.
Oh, okay. I'll check my flock of chickens.
Yeah,
I know you have half a dozen of them.
There you go.
That's why we get the fresh eggs.
Yes, absolutely.
All right, Monica, thank you so much.
Thank you.